2020. Oh my, oh my. It's been a year, of course, of many, many ups and downs. Of course, COVID, front and center, taking over everything that we do. It's been an especially difficult year for people who are on the front lines. And I'm so happy to have with us on the Elias Macco Show, Joanne Brack is filling in, by the way, Dr. Nicole Ezer, who's a junior scientist at the MUHC Research Institute, as well as an assistant professor at the Department of Medicine at McGill. Also, I have to put the cards on the table, a good friend of mine, Dr. Nicole, how are you?
I'm good, Joanne. Thank you. And Happy New Year.
Happy New Year. I, of course, want to talk to you about all the hard work that you've been doing as a respirologist. I mean, we spoke earlier in the summer when you were in the thick of things and things were so difficult and they continue to be difficult. But the big news is, and you posted on your Instagram, and I was so happy to see it. You said thank you to all the master's, PhD, postdocs, and scientists who believe in research and work tirelessly for this. This is change. This is science, and we owe you, ça va bien aller. And it's a picture of you getting your vaccine. Woohoo!
Yes, I'm so relieved, and it was a great way to end 2020. It was quite an emotional moment, I can tell you.
Well, tell me, Dr. Ezer, tell me how that went for you. First of all, you described the emotion. Just take us through that moment.
Well, I was vaccinated at St. Anne's Hospital in the West Island, and the vaccination campaign is in the gym there. And just walking in, it was such a relief to finally see the beginning of the end here. I work in a long-term care home when there's patients on ventilators, and that's one of the reasons that I was vaccinated so early. And I've been so worried for our patients, especially because they're very vulnerable given that they're on ventilators. It was just such a relief to know that, they're going to be protected, that the healthcare workers are going to be protected as well. It's been a very stressful, last 9 months, and this is just a huge relief. And
I'm guessing there could have been some tears, that sort of rush of emotion, I'm guessing.
Yeah, it was just a rush of emotion. And I think also just doing it at the Veterans Hospital where you see all the poppies on the wall and all the pictures of people who, fought in the wars and cared for there by the staff. It just brought up a huge rush of emotion. This is kind of, our fight of our generation. It's definitely by no means the same, but
it's a battle. It's definitely a battle.
It's been a fight, yeah. So it was definitely an emotional moment.
We're speaking,
and also,
yeah. Sorry, go ahead.
Yeah. Also, I think, one of the things that I was just so proud of all the people who really believe in research, and that's really pushed us to get here so fast in terms of having a vaccine. All those master's students and PhD students who are, studying all the time and in basic science labs, and it's hard to see the end game, but this is the end game of all that work.
Yeah, we're speaking with Dr. Nicole Ezer again. She's a respirologist at the MUHC, who's been fighting COVID since the beginning of this thing, and who just got her vaccine. You can't see this, but I'm smiling ear to ear because this is we're looking for feel good stories. We're looking for hope, and you getting this vaccine and the vaccine starting to roll out. Of course, it just warms my heart. But I do want to talk about the last 9 months, right? You mentioned how difficult it was. And, you're seeing people are traveling. People seem to not be following the rules all the time. What does that do to you when you see that, when you realize how hard it's been for your colleagues, for the staff, for the support staff? What does that do to you?
I think, anyone who knows healthcare workers who are working right now, who has a nurse in their household or a préposé or anyone working knows how hard this has been. For everyone who's on the front lines who's had their vacation canceled, that it's been a really long 9 months. Your people taking a vacation and flying south, I understand it's really hard mental health wise and people need a break. But unfortunately, our healthcare workers are not really getting a break that they deserve over the holidays. And, a lot of our nurses have had their vacations canceled. And it's really frustrating, that they're going to have to take care of patients who, get COVID while they're traveling. And, they see them in the emergency room and coming back from a nice holiday, and they just have been working through it. So, it's a bit disappointing. I understand that there's a big mental health toll to this pandemic, and that's really huge. And I don't think anyone underestimates that. But when the end is in sight, it's really frustrating to have people that aren't
Yeah.
following the rules.
We're speaking with Dr. Nicole Ezer again. She's a respirologist at the MUHC, working tirelessly fighting this virus, fighting COVID, who just got her vaccine. So many people have questions about the vaccine. When are they going to get it? When are they eligible to get it? Is it safe? What can you say to listeners who maybe need a little bit of reassurance when it comes to the vaccine and the speed with which, we got it?
I think a lot of people are concerned about the speed with which the vaccine was rolled out. But I think one needs to sort of put things in perspective. The vaccine was approved very quickly, but not because they changed all the regulatory rules that it has to follow. It was because they dropped everything else to get this vaccine approved. So, the same rules that any vaccine needs to meet in terms of efficacy and safety had to be met for this vaccine. And it was approved quickly because everyone stopped what they were doing to approve this. Normally things are really slow to get through all the regulatory hurdles, and it's really just because the machine is slow, getting Health Canada
There's
approval,
a lot of
getting
sort of
FDA
bureaucracy
absolutely.
around
It needs to be read through with everything else that's on the table. And whereas here everything stopped so that, all the COVID-related projects were prioritized. I had that experience myself at the beginning of the pandemic. We were running a clinical trial on treatment of COVID, and Health Canada approved our project, within 3 months, and normally that takes 9 months to a year. So, everything has been accelerated because everybody's attention has been on treating COVID and finding solutions. So I think people need to realize that the process is accelerated, but that's because everything else has been put on hold.
Everything's on the back burner. Tell me about this clinical trial, because you're still in it and you're working on treatment, right? Because it's not just about the vaccine. People who have it also have to receive treatment.
Yeah, so we're looking at treatment of patients, who are not hospitalized, who are outpatients who have COVID. And we're looking at treatment with an inhaled steroid and a nasal steroid to decrease the severity of symptoms. So you may know that, in the spring, there was a big study that showed that steroids given to patients in hospital who are very severely ill made a huge difference in improving outcomes in patients that had COVID. So we're doing a clinical trial of using inhaled and nasal steroids to decrease the severity of COVID in patients who are not hospitalized.
And you're still actively looking for people.
Yes, we are. So we're recruiting participants anywhere in the province of Quebec who have COVID recently diagnosed. All the enrollment is done online. So you go to our website, which is www.contain-covid19.com. You fill out some questionnaires and you have the medications shipped to your house if you're eligible. And so we're looking for adults above 18 who are, infected with COVID and have respiratory symptoms to see if we can decrease the severity of those symptoms.
Again, speaking to my friend, so I'm not hiding that fact. I went to high school with Nicole, Dr. Nicole Ezer, who is a respirologist at the MUHC, who has just received her vaccine, who continues to fight the good fight when it comes to trying to get rid of this nasty virus. Before we go, there are people who continue to say this isn't real, this isn't as serious as we think it is. It only affects a certain group of the population. You're there, you're on the front line, you've seen what it can do to people. What is the parting, I guess, words for people as we start this new year? But yes, there's hope, but it's maybe try to get them to understand how serious this is.
Yeah, I think, people need to understand that, there's definitely a proportion of patients who are otherwise healthy who have severe effects from the vaccine, whether that's getting severe respiratory symptoms or having symptoms of long COVID, like prolonged gastrointestinal issues or issues with smell. And these are patients who don't necessarily have any past medical history. So I think people need to realize that we can't predict who those people are, that the majority of people do well, but there is a proportion that's not insignificant that do have severe symptoms. So I think, that people need to remember that it's not over yet. There's a light at the end of the tunnel, but it just hopefully after a few more months, we can get a bit more control and relax on the rules. But right now,
But we're
we're
not,
still
but we're not
really in
there
the thick of
yet.
it.
All
Yeah.
right. Dr. Nicole Ezer, again, respirologist, MUHC, just received her vaccine. Happy New Year, and thank you for all the work that you do.
Thank you,
All
and
right.
stay
Talk
healthy.
soon.